And you see, I am convinced that God just called my daughter. Anyway, eventually Museveni came to talk. And then he says, Prince Katama was telling that God called his daughter. I don't know. You see, when she was taken to that hospital, they had no blood, they had no gloves, they had nothing. So, I think if we were to be a little bit more careful, God will stop calling us. Because you know what? He doesn't call the Japanese, he doesn't call the Americans, he doesn't call the Germans. Everybody lives up to 100. Anyway, he was bringing fire upon his own head, isn't it? Next, he called the Minister of Health, says, sir, where are you? Come, isn't it? Yeah, that was the first story. And the second one is that Dr. Jan Clark is here. We know each other because when I came to Uganda in 1997, he was already there dealing with the healthcare. Yeah, and he wrote a book. I don't know if you have heard of it, but called "The Man with the Key Has Gone." So it is such that in the hospital, a guy says, "Don't allow them to steal the blood or whatever." So you lock it. The guy locks it, but then he goes home. Then the doctor comes, says, "Please give me whatever." Sorry, doctor. The man with the key has gone. And the guy dies, isn't it? Yes. And that lady, she was doing some, I don't know, moonlighting in some other thing. Eventually, she forgot to put the medicine there. The guy didn't take the stuff at night. Then he's seeing Jesus in the morning. Now, gosh, it is so different from the aviation industry, isn't it? Nobody dies there. You know, everything is, you text, you retest, and you do. And this is where we would like us to go with health. Not a lot of money, but a lot of care, a lot of training, a lot of technology, a lot of beautiful things that we can do. Multidisciplinarity. Institute of Healthcare deals with the Internet of Things, isn't it? Drones, logistics, healthcare management, my electricity. I put solar there and you conserve the vaccine, you get mines, etc., etc., etc. So it is very good to have you here. And I'm really, really excited with what you are going to discuss and do. Obviously, I will pray for good deliberations. Thank you very much.
Thank you so much, Professor Silva. Now we clearly understand why he's a certified engineer, energy engineer. He has the passion and the likes. So straight ahead, I'll invite the next person to give us a few remarks. I'd like to welcome Dr. Kanyenye Gakumbe, the chairperson, Kenya Healthcare Federation, to give us a few remarks for 3 minutes. Karibu, Daktari.
Good morning. In the 3 minutes I've been allowed, I will not spend much time on protocols. I wish to thank our chief guest for joining us today and to let our brothers and sisters from East Africa know that the CS is not here, the CS is not here. They are engaged somewhere else, but we have their support, and there is nothing that we'll discuss that Kenya should do that will not be in a position to deliver on between the ministry, KEPSA, represented by the chair, and the Kenya Healthcare Federation. So karibuni sana. Our expectation as a Kenya Healthcare Federation as we meet is that by the end of these 3 days, we should be challenged to deal with the emerging challenges in the health sector. Among them is UHC and the rates that providers are being offered to provide service. The second is digitalization. The third is people. The fourth is supply chain. Fake imports. I needn't go into details because this is a subject that we are all familiar with. So let's have the conversation, knowing that if we are ever going to catch up with the rest of the world, we'll not do it by copycatting. If you're going to catch up with the rest of the world, we'll not do it by traveling at the same pace that they have traveled. We have to do it at a much, much faster pace. Let us do it knowing that the recent history of COVID taught us some lessons we should not forget. And one of those lessons is the need to mount an all-of-country response when we face a big challenge. And health continues to be a big challenge. So we would like everyone, government, non-profits, NGOs, the private sector, to continue to work together to deliver on the big challenge of delivering care to our people. Let us remember that there comes a time when people cannot travel anywhere by plane. And therefore, we need a working Eastern Africa, so that if we cannot go to India because there are no flights, then we can get the care we need here. Let us remember that the region has delivered solutions to the globe. M-Pesa is one of them. So we do not always have to be followers. Let us remember that at least for Kenya, the Ministry of Health is trying to discourage unnecessary travel out of the region for healthcare, and doctors like me are increasingly being asked to sign that the care somebody is traveling for is not available in country. But as the ministry does that, we were challenged, we who are providers, to make sure we offer a viable alternative, because Kenyans have the constitutional rights to seek care wherever they want it in the world. So the ultimate solution is that the care is available here with as good a quality and with as competitive a price. That, for me, ladies and gentlemen, is my expectation, that we'll have a conversation and we'll be in a position to leapfrog, to innovate, to come up with solutions that make us the hub for care in Africa, and beyond that for care within the globe. It can be done. We used to send students to India as a country. We no longer do. We have no reason to be sending patients, because Strathmore is among those institutions that offered an alternative to sending students outside the country. There is no reason why we cannot follow the example of the education sector to do the same for healthcare. Thank you, karibuni, and happy deliberations.
Thank you so much, Dr. Gakombe. So at this particular point, I'd like to welcome the chair of the Kenya Private Sector Alliance, Flora W. Mutai, to give a few remarks. 3 minutes as well.
Distinguished guests, chairpersons of organizations, ladies and gentlemen, and doctors. And as growing up, doctors were supposed to be, a profession that we all revered. Good morning. They say never waste a good crisis. And there's never been a time that we have seen the health sector appreciated like what we saw in the last couple of years that have happened. It was not your money, your connections, or anybody that you knew could keep you alive. We saw it bring down presidents. We saw it bring down the poor. We saw it bring down the rich. And the only solution and the only way we could mitigate it is, the isolating, the washing, the masks. Really, we relied on the health sector. And for those who treated it normally, it treated them abnormally. Indeed, the East African Healthcare Expo comes at a no better time to provide us actually with a platform to discuss and on how to bolster this sector and to continue to drive our economies. As the private sector, we believe that health is in every sense the foundation of economic and social development in Africa and the globe at large. Over the years, we've always advocated for quality health, and the pandemic is actually what brought this to light. As I say this, I say collaboration in this sector is actually going to be very important in delivering quality health. We know the private sector is a key enabler of medical tourism, channeling investments in healthcare, promoting innovation and creativity in health. KEPSA, the private body that I chair, actually has a membership of large and small organizations of up to over 1 million businesses. And they include, of course, private healthcare facilities and private health insurance companies, which by and large are crucial participants in the health economy. Over health supporting health sectors, it also supports other areas in agriculture, manufacturing, transport, which are also part of us, let alone that tell us not much of who we are in this health revolution. As a private sector, we've been keen in urging government, whose main focus has been social health protection, medical tourism, health infrastructure, healthy, high-impact interventions, digital health, human resources for health and quality care, and worker safety in addressing challenges experienced in the sector to invest in mitigating initiatives. We believe, well, one of the things that we're very proud of is actually the vaccine production facility, and we believe that together with other initiatives, it will be of great deal in advancing health in Kenya and the region at large. It will help address the challenges of the COVID-19 deficit and curb other diseases that have been ailing us, such as malaria. As KEPSA, we have harnessed our efforts through initiatives like through the Health Sector Board. We partnered through this pandemic through Wheels of Life. We helped pregnant women through a toll-free number, engaging doctors. I think we did over close to 10,000 of those. We helped obviously in resource mobilization. The numbers were very much out there. Telemedicine was something we were quite excited about. 40 telehealth providers have been registered, and mobile platforms have also been developed. And this has promoted a lot of on-demand mobile medical consultations. Advocacy is something that we do well and a lot. And as we continue in our engagement with government on health-related issues, we have continued to partner with them to strengthen the healthcare system and improve the quality. For example, we developed together the digital healthcare regulations to provide a legal framework to institutionalize these telehealth medical services. Again, KEPSA partnered with an MOU with the ministry to actually promote vaccination. We gave some funding to help, and we also committed to taking up the costs of vaccinating free of charge during the vaccination initiative. Recently, the IMF, in partnership with the Healthcare Federation and several other organizations, also worked together to increase access and availability of medical equipment and associated services in West and Eastern African countries. I think as I speak about collaboration, let me also speak about the government being part of this, and would like to really thank them for bringing up the whole UHC, Universal Healthcare, which saw the recruitment and deployment of more health personnel, expanding intensive care units, and investments in medical equipment. We are also aware that health costs continue to bring about poverty, and universal healthcare means that all citizens can access, promote, prevent, curate, and rehabilitate palliative healthcare services they need. And as you heard Dr. Kagombe said, we do not need to be traveling outside the country if we actually have the healthcare here. I personally know I've been invited to less harambes. Actually, I'm trying to think of a medical harambe I've been invited to in a long time. Other than collaboration, the other thing I think is going to be important, and I hope you're going to be discussing it today, is just innovative ideas. I was just speaking to Nick just now and saying we cannot only be talking about M-Pesa being the one innovation that we get off the continent. Perhaps let it be from your fraternity that we actually do we promote innovation, including promoting innovative policies. And I can see you right here. As I conclude, I believe it's crucial to secure and safeguard the gains that have already been made and chart new paths. I reiterate that we must continue to engage, we must continue to collaborate, and we must do so innovatively. We must continue to have stakeholder dialogues in policy coordination for the healthcare system strengthening. The regional health goals calls for a more robust and resilient health supply chain, effectively assuring security of health products and technologies across all levels of the healthcare system in an equitable, reliable, and cost-effective manner. It is crucial, as we know an effective health supply chain not only improves the health outcome, but also steers economic development. And with that, asanteni and enjoy your forum.
So thank you so much for the warm introduction. So at this particular point, I'd like to welcome Nicolas Nesbit, the chairman, East African Business Council, to give a few remarks. Minutes as well.
Good afternoon, everybody. My name is Nicolas Nesbit. It's a great pleasure to be back here in the Strathmore Auditorium, seeing all of you and having a very important discussion today around East Africa healthcare. So I'll give a few comments today, really coming from my perspective, personal perspective as an entrepreneur many times over. As a leader of a tech business, I ran IBM's business here for many years. I had the honor of handing over the chairmanship of KEPSA to Flora Mutahi. I'm chairman of the East African Business Council. I'm also a regulator as chairman of the Capital Markets Authority, so I have a view on capital raising. And I also come from a family of doctors, so I could see firsthand what it was like. My father was the first non-white doctor to get admitting privileges to Nairobi Hospital, had the first non-white patient, and I think he was Kenya Medical Association doctor number 2 or 3 or 4 or something like that. So I could see and feel and hear from my parents the development of the medical fraternity in Kenya. And I sometimes wonder if he were still alive, what would he think of what has happened in the medical community? And as I frequently get reminded by people who are my age or a little younger, your father used to give us injections and they really hurt somewhere in town. But it was at a time when there were not many doctors, there were not many professionals, there were not many specialists. And now everywhere you go, there are huge medical facilities and many, many doctors of all kinds of specialties that were not there before. So when we talk about do people need to travel out of the country, I firmly believe that they do not need to, because we've now got very, very good doctors who've been trained in Kenya and trained all over the world. In fact, I was supposed to be a doctor and was accepted at Nairobi University for medical school and dental school, but they loved throwing stones, and the schools kept getting shot, and I was told I'm going to live at home. So America just looked so tempting. I became an engineer and did not do it. But, you know, as I reflected on the topic here, how do you create innovation? How do you encourage investment? How do you grow this sector? How do you attract people to come and invest here? I think about what brought me back from America 20 years ago, which was to be an entrepreneur. And what I wanted to do is teach the rest of the world that Africa can actually succeed as professionals as opposed to just as athletes or tour guides. And what I wanted to do through my call center and all the business process outsourcing work was show Americans, Australians, Canadians, British people that the Kenyans here could do it. And it was tough. And it was really, really tough because you have a big mindset you have to overcome. Send my accounting, my insurance work to Africa? And I sat in an office in Boston, and somebody said, "You mean I'm going to give you some work, and that's where people go and get burned by trying to scrape fuel from a spilled oil tanker? No way." So as we try to become a country that promotes medical tourism, we've got to think, how are we going to overcome some of these hurdles? And so we have to think about the mind of an investor and the mind of an innovator. And as we just heard, we must go beyond just M-Pesa. But to innovate, it's a whole process. It's a whole process around innovation. And you've got to think really carefully about it. You've got to identify what is the real problem, actually the genuine real problem, and can we solve those problems? And who do we need on the bus to actually solve those problems? And what resources do we need to get it done? Is it financial? Is it facilities? And so on. And do we have the agility in our processes to bob and weave to eventually get to the target? And so to attract investment, the investors are the people who have succeeded before, and that's why they have money and you perhaps don't. So what you have to do is speak their language. And their language is about, am I going to get a return? And nowadays, is it an ESG return in particular? And do they have confidence in you as the entrepreneur that you can confidently articulate your problem and that you will be able to solve it if you only got their money and their attention, and you can actually manage the risks of regulations, government policy, and so on. And if you get past that, what they're also going to ask you is, now you want to become a medical tourism in Kenya. Why? And what is your differentiation? Basic business. I'm not going to be a doctor here, but it's basic business. If I have a knee injury, where's one of the best places in the world to go? Switzerland. Why? Because people ski and mountain bike and they destroy their knees. If I have hip problems and other kinds of problems, where do I want to go? On the continent, South Africa. They've got hundreds of very good orthopedic surgeons because they play a lot of rugby and they have a lot of sports. If I'm going to go to the United States and I want to have treatment for cancer, I go to New York. It's got a lot to do with diet. It's got a lot to do with other things. So what is it for Kenya? Tropical diseases, communicative diseases, organ transplants, war and battle injuries. Who's our target market? Is it surrounding countries? Is it rest of Africa? Are we taking tourists from Vietnam, from Thailand, from Dubai, Europe? Where are they coming from? But I see many challenges in the profession, having seen what my dad went through as a doctor, what my brother went through as a pediatrician. Big challenges. If you want to be the hub, you've got to allow the best doctors in the world to come to Kenya. My brother's a pediatrician, tried to get some real specialists to come here, or even married here, had children here, and the medical mafia, that's my term, not his, said, no, Kenya's for medical doctors. Kenya is for Kenyan medical doctors. We don't need foreign doctors. Competition is not the foreign doctors. When you walk through any of these medical facilities, competition is mediocrity. Competition is lack of differentiation. Your competition is somebody who has a choice that's different from those two board secretaries sitting in your clinic, speaking to doctors, who don't have anything to say to you while they make you wait an hour, right? It's that whole experience. It's government over involvement. It's intellectual property thought. It's governance issues. It's lack of local investors in healthcare. If you go to any of the facilities, the other day there was a Merali facility, thank you, at Kenyatta National Hospital. There's a Chandaria Institute, there's an MP Shah Institute, and the point is you're not getting enough local Kenyan capital investing in this Kenyan industry. Hopefully after August 8th, people will no longer invest in helicopters, but they'll use all of their wealth, wherever it came from, to invest in cancer facilities and pediatric facilities, instead of helicopter facilities. So that needs to change. We need technology. I spent a lot of time at IBM trying to put in blockchain-based systems at KEMSA and other hospitals and everywhere. Didn't happen. At CMA, I was asking the other day in preparation for this, how many medical facilities do we have? How many medical companies are listed on any of the exchanges? Nothing. So we'd rather take our money and put it in Dubai, Vietnam, Thailand, England, South Africa, or something like that, than put it in a local company that can actually deliver. And I like what we heard earlier about Arusha only as a statement, because I say there's too much reliance on God. And God becomes an escape, especially, unfortunately, and perhaps unforgivably for scientists who call themselves doctors, who want to say, when it's your time, it's your time. Why was it not the time for that doctor to have operated well and have spent time and attention? Why was it not time for the blood to be delivered? Why did God not help them, as we heard earlier? And it was interesting because that was a big point. I hear too much reliance on God. God is not only there for the bad times, God's also there to help you through the good times. And when God is making asteroids and new planets and volcanoes and all of these kind of things, I hope God has time to pay attention to the doctors who are supposed to help us. So if we're going to attract patients, we have to think international. We can't keep thinking Kenya is for Kenyans. At CMA, I'm dealing with all the time big international companies, local Kenyan investor. The local Kenyan investor comes to me at CMA, please kick those international guys out because Kenyans need to own this company. And I'm like, Kwani, who are the Kenyans? It's you and your wife and your children. Those aren't Kenyans. Yeah, you're a Kenyan. But really, what does that do? It's chasing away international investors because we're Kenyanizing it. But we need to partner with other cities. We need to partner with other counties. We need to partner with other countries. We need to partner with other medical establishments. My brother was trying to partner with Seattle Children's Hospital, and the hell he went through, and he couldn't get it done. Right? Imagine Seattle Children's Hospital partnering here in Kenya. What that could mean in terms of specialists and for your children when these people can come here, these doctors and so on, and blood can be sent. So for us to think international, we need an ecosystem of providers. We need the right prosthetics, we need the right care, we need the right ambulatory services, specialized beds. You need all of that. When I was doing call centers, I was the only one. You can't create an industry if you don't have everybody. Try going to the middle of South Sudan and create a tourism industry with one hotel. It ain't possible. You need the infrastructures. We like building facilities, but we don't put the soft skills in there. We need technology. We need medical professionals, and we need really good support staff. Why does England want to take all of our nurses? Because they're very good. But as leaders here and managers, we don't make them as good as the people in England do. And what do they have in England that we don't have? So from personal experience, I think if we want to really attract people, our overall customer journey, the overall patient journey, for the patient, for the doctors that accompany the patient, for the families who accompany the people, has to be a first-class experience. You've got to get value for money. You can't only stay at Serena for $250 a night, but you should be able to stay somewhere near the hospital when your loved one is being treated. Above all, you need successful outcomes, and you need a duty of care from all the providers in the system. You need good follow-on care. You need good affordable food, facilities, and so on around you. And above all, you have to have good brand marketing and awareness, which comes from good stories and people talking about it. And if you want to stop people from traveling, you have to do the same thing as what I said, which is to attract people here. So keep the Kenyans here, and it's good to see that we're not doing Harambes, as Flora said. But if we really want to attract people, why are they going to come here? Why are people going to invest here? And what's that experience going to be like? And as I wind up here, I'm just reminded of a few personal experiences. My wife had a hip replacement. She said she spent 6 years in pain. And the advice she got was pray, exercise, lose weight, drink more water, have this spinal injection and that spinal injection and that spinal injection. And finally, a doctor looked at MRIs that people here had said were not good, a doctor in South Africa, and said, your hip has completely degraded. I don't know why people have let you live in pain for 6 years. She went to Cape Town, she had a hip replacement. By the time I got to the hospital, back to the hotel, having left her, did emails for not even 30 minutes. The surgeon called me and said, she's out of hospital. Less than an hour. The next day she was walking. 2 days later, she was out. My next door neighbor has spent 3 months in hospital here from complications of a hip replacement. Think about that difference, right? And her mother was given 6 months by her doctor here to live because she had cancer. And they said, just have her pray and so on and so on, take this medication. She went to England and they told her that one more week and she would have died. Her mother lived another 8 years, stem cell transplants and all kinds of things. And one thing I learned about pain, having witnessed all of this, is they say there is no reason in 2018, that's when she passed away, for any patient to experience pain. To experience pain. The patches, the injections, the things that she had, the 6, 7 doctors that sat there and looked at her as a chemistry experiment. More zinc, less this, more sodium, less that. If you put this, this is what's going to happen. And I would witness these people talking about her in a way I've never seen before. I mean, it's like the way businesses solve a problem. Yet when she was here, it was one doctor who was not in this specialty who knew. I don't know how he knew, but he gave her 6 months. The other doctors gave her 8 years. And the list goes on and on and on when I hear of my brother, and he would just independently realize he couldn't get the help, and he was always on the phone with India and New York and so on for a little patient that had a car accident. And I remember that because people come to Kenya from Finland and these other places where they wear seatbelts, and they don't put their children in seatbelts here because they can give a policeman 500 shillings. Then they come to him for specialist care. And now that he's in Canada, he's doing the same thing, and they expect him to work 3.5 days, and he's working 5.5 days, and the list of patients is long. And what I say to him is Canadians don't need an African doctor. Africa needs Canadian doctors, but for personal reasons, he left. And he's a star over there. And there's no reason why all of our good doctors here would not be stars in England or America or Canada as well. But the point is, do we believe that we are stars? Do we believe that we should have this? And on so many government presidential trips I've taken, and you're going in buses with people with big titles and leadership, and they look at all these buildings and they just think, Hini Yahawa. They don't think that we deserve it, that we believe to have it. And as I close, I just think of a tweet my other brother sent me today about Lewis Hamilton. And Lewis Hamilton, for those who spend time watching and studying outliers in the world, he had a little tweet, a little message that showed him with a broken hand. And when he was 15, he fell off his bicycle and he broke his hand. And he went to the doctor and they put a big heavy cast. And the next day, he had to compete in some go-karting championship. And he couldn't drive his car. So he personally got on whatever he did, a bus, and he went somewhere else, and they took off the heavy cast and they put on a very light cast. And he could race the next day. And he won by a lot, driving with one hand. And that got him a sponsorship to McLaren, which led to him eventually becoming perhaps the 8-time world champion. And what he said was, you just have to believe. And last weekend, if those of you watched, he was 19th and he finished 4th or 5th because he didn't give up. So I'll say to all of us, we know what needs to get done. We can learn from other industries, other people, other countries, and let's do it for ourselves, but let's also do it for the people who are relying on us in this room these 2 days who are not here. So it's up to us. So with those few comments, let me say thank you and good luck this week.
So thank you so much, Nicolas Nesbit, for the insightful insights. I'd like to welcome a private sector development specialist to delve deeper into what Nesbit has talked. So a round of applause to Charles Kahutu, the CEO, East African Chamber of Commerce, Industry and Agriculture, to give us a few remarks.
Thank you very much, Mr. Moderator. Okay, thank you, Nick, for quite exciting remarks, of course, as usual. I don't know where I can start because really you have touched virtually everything that the private sector can really talk about. As you have been told, my name is Charles Kahogo. I work for East African Chamber of Commerce, Industry and Agriculture. I have been a private sector for a very long time. I consider myself quite a specialist in that area, working on policy issues. At some point, I worked for KEPSA. Policy advocacy is something that we've been doing, and we do also as a chamber. But the work of the chamber so far is actually trade facilitation, looking at the value chain and basically going at the higher spectrum of that, taking goods and services from the producer to the consumer. That's our work. And Nick and I really work for the region, EABC and our chamber, East African Chamber of Commerce and Industry. We work in the same space, so we interact quite a lot. If not with him, with the staff in Arusha. When you invited us here, of course, it was very, very exciting for us because in East Africa, we want people to come together, and for Kenya Health Federation to bring us all together, that was quite something, and more so to come and discuss an issue that actually is of interest to all of us. I think COVID opened a lot of eyes. It brought out quite a lot of innovation, which is within us, because really it came and turned things around. As Cabinet Secretary Mutahi Kagwe is used to saying, it is thinking abnormally. You know, we have to think outside the box. But more so, how do we, in fact, make ourselves as a region, because I can't talk about Kenya, as a region, to be able to build the capacity that we really need to know that COVID and other epidemics that will be coming, actually, we can be able to cope with them. Do we have the capacity that is needed here? Are we investing enough? I think Nick has just talked a little bit about that. Are we really thinking about the investments that is necessary in health? Not many countries in the region, and I think I'm aware of this, invest in health, not enough resources. We don't have enough doctors as well. And those that we have, I think we also need to challenge ourselves to see whether, in fact, we are delivering the services in a professional way that our so-called patients or the people we provide the services to would require. That is, I think, something that we need to think about when we actually are working. And this conference, I believe, will be able to bring out some of the issues that we need to do to bring back the professionalism that is needed in this particular profession. The sector of health is very crucial. In fact, nothing else can happen if actually we don't have a productive and healthy society. So basically, you can see that actually the challenges that we really have to kind of overcome. And I don't think, as I just have said earlier on, that we are looking at that in a manner that is, you can say, it has been given priority. Are we prioritizing health services delivery? Are we putting enough money? That is a challenge. We need to know what we have to do in the next phase of actually, because next year we might have another pandemic. I hear there is a monkeypox or something coming from the US. I don't know whether we are ready. This is something that Kenya and the region has to start thinking about. COVID came, and fortunately, it didn't impact so heavily in Africa, but it came, and actually we saw what transpired. Industries, more or less, some of them went under, and completely went off. Some of them we are trying to revive, and we shall revive them. Health sector included, health industry. So the investment needed is crucial. The private sector, I think, can actually play a great role to support the government initiatives. And I think that is the conversation that we should start having now. We have good public hospitals. We have Kenyatta, we have Kenyatta University, which are fairly good and they are coming up well. But private sector hospitals are also coming up, and they have actually shown that they can do a job of supporting what the government needs to do to be able to support healthcare delivery services. I can say further afield from outside the region, we have the African continent itself. The continent needs to work more also with itself. And we have players in the continent, countries in the continent that can actually support capacity delivery of capacity building in other parts of the region that may not be that much well endowed. We have Southern Africa, and South Africa is there. It is very good. Nick has talked about what can be done in the Cape Town hospitals and others. We have Kenya. I think Kenya, we are also being recognized as can be a little bit of a center of excellence. But we have Egypt up north, which we have not been thinking about a lot. Egypt, I think, has, last time on Sunday, we were talking about this particular topic with one of their ministers. They have about 480 pharmaceutical industries. They are able to do a lot for themselves, and they are ready to partner with other parts of the continent. Are we ready ourselves to partner with players like those ones? Do we want? Because don't forget, Africa, to be able to survive, has to, in fact, start working more closer with itself. We must break what you call national boundaries, so that if Kenya is more endowed with doctors, Uganda can come in freely to bring about the kind of thing that, the kind of medical tourism that is required. But I am challenging us that we look within ourselves whether we are doing enough, and if we are not, what do we need to do to be able to bring our health care service delivery to the level that is required by the recipient of those services. I think that's a challenge for us. And for me, I believe that is what the private sector, which is in abundance here, and the public sector should start thinking of wanting to do. More partnership with ourselves, more partnerships with our neighbors, particularly within the continent, and more investment in the health sector, more provision by the government, and attracting those private funds that we do have to put more money in the delivery of health services. I believe that's what I want to say for now. As I said, Nick is my contemporary in the region. I think he talked quite a bit of what we need to talk about. But from a private sector perspective, I think we are not doing enough to support the public sector to put in place healthcare delivery systems that are needed for the region and for Kenya for now and for the continent. In fact, on Saturday, I'm going to Cairo, and I think we are going to discuss this topic. One of these things, how we can, in fact, use the capacity they have in Egypt to roll out healthcare delivery systems and pharmaceutical industry capacities within the continent, with a view to making the continent become more self-sustaining instead of waiting for our colleagues in the United States or Europe to come to help us when another pandemic hits. We need to be quite ready. I know Kenya is trying to put together a vaccine manufacturing facility. I know Kigali also has approached the European Union for support. These are the kind of initiatives we need to start thinking about, making ourselves able to, in fact, do that what we need to do if another pandemic hits. I'm talking about that because we are talking about healthcare today and tomorrow and the day after. There are other initiatives we need to deal with to support ourselves for Kenya, for the region, for the continent to become self-sustaining in many of the things that we need to do. I think I don't want to talk more than that. We can say that tomorrow I'll be here again, I think, as a panelist or something. We can discuss very specific issues. Thank you very much, Mr. Moderator. I think I will leave it there. Please give you back the floor.
Thank you so much, Charles, for the insightful words. So at this point, I'd like to welcome Dr. Ian Clark, the Chair, East African Healthcare Federation, to give his remarks.
Good morning, everyone. Like Professor De Silva said, I'm also a Ugandan. Maybe I have to explain. There's not so many white Ugandans, but I originated in Ireland and I've been living in Uganda for over 30 years. I suppose I'm a kind of social or medical entrepreneur. I've been able to start 2 hospitals in Uganda. One which is very much a charitable hospital, a rural hospital, runs very well with the aid of donors, significant funding from donors, and another one which is a commercial hospital, which also runs well and charges really what one needs to charge for healthcare here. This year I'm the chairman of the Uganda Healthcare Federation. The Uganda Healthcare Federation is really, it came together. I think the first federation that was formed was the Kenya Healthcare Federation, of which Dr. Gakombe is the current chair. But several years ago, probably 11 or 12 years ago, we formed the Uganda Healthcare Federation, and now we have AFTA, which is the Tanzania equivalent of the Tanzania Healthcare Federation. We've got the Rwanda Federation. We have a fledgling Burundi Federation. We have South Sudan. We have Ethiopia, really in the region. And in fact, I'll just put a plug. We're going to have our annual conference. It'll be the first time we've had a physical conference in the last 3 years or so, on the 20th to the 30th of September in Kampala, when the delegates from across the region and across Africa will come together, and we'll be discussing, the theme is building resilient systems for evolving health challenges, the inevitable role of Africa's private sector. Because the reason that these federations were formed were to give a voice to the private sector. Because so often health is considered to be a government prerogative, and the attitude sometimes is that the private clinics come in just to do some cherry picking, to make some money, and not make a real contribution to health. But I must say, I've been, in my over 30 years in healthcare in Africa, in Uganda, and I also have something in South Sudan too. What I have, I think I feel like there's still a deplorable lack of collaboration and cooperation between the public and the private health sectors in East Africa. We're talking about, the theme of this conference is East Africa as a hub for specialized medical care, investments in health, and innovative healthcare solutions. I don't think any of us think that people will be coming from New York to Nairobi or to Kampala for their medical treatments, but we do realize that there's a tremendous drain as our people go out to India or South Africa or anywhere else but the region to get their health care. And when we hear stories from people like Nicolas of, you went here and you had this kind of health care, and then you went there and it was something very different, we hang our heads in shame. Now, I'm not saying that's the whole picture here. It's not. But I think that, like the school reports say, could do better. I think in the region we could do better. Now, when I look at the region, I look almost in awe at Kenya. Nicolas is complaining about his country here, but I, as a Ugandan, look at Kenya and say they're so much further ahead in terms of what they're offering in healthcare. They're even further ahead, as far as I can deduce, in terms of their public-private collaborations and in terms of what they're trying to do with healthcare, national health insurance here. But when I look at my own country, and I'll be critical of my own country because I'm not going to criticize someone else's country, but we put up so many barriers. We make things so difficult. Okay, we pay lip service to say this is how we're going to solve the problems, and then we introduce regulations, we introduce barriers, we don't really talk to each other, and we don't have a common sense approach to solving the issues of healthcare. And I look at some countries, here in Africa, we're very, very big on protocols. We're very big on titles. We're big on politics. But when you want to solve something, actually, what it needs is people to sit down together and get common sense solutions. What can you do? What can I do? How can we make this better? And we're in an age now, because of COVID, and it was a bit pathetic to see Africa there with the begging bowl at the end of the queue and all this sort of stuff. And we feel fortunate that COVID didn't really hit us as badly, perhaps, as it might have. But it has made us think. So how are we prepared for epidemics? How are we doing as far as healthcare moving forward is concerned? And there's three things that strike me here in terms of discussion points for how we can move forward. One is, how do we work regionally that we can make the best of what we've got? It was alluded to by a speaker earlier that there is a regional plan for healthcare. But what are we doing, and the East African community comes into this, cross-border regulations come into this. How regionally can we make ourselves better? For example, we all have these very strict regulations about importation of drugs, National Drugs Authority, and so on and so forth. But when somebody wants to set up a drug distribution or bring in drugs in Kenya, they'll go through all that. They'll go through a lot of stuff, and then they'll go through it again in Uganda if they want to come to Uganda. Now, I know there's a bit of work going on in this, but how can we streamline our regulations that we actually can take down some of these barriers that are just not necessary? So much of this stuff is simple rent seeking. It's simply people making money, having a job from having a regulatory position that gets repeated all around the region as such. So how can we take these barriers down? Because we're the ones that put them up. The other word that I want to use here is digitalization. Digitalization, I don't know if it's digitization or digitalization, is going to be the game changer. It's already a game changer in so many industries and so on. And it's going to be a big game changer here in Africa. With COVID, we realized we can't even get to patients at many times. So the virtual platforms that are happening, the leapfrogging, we know what happened when mobile phones came out here. When I first came here, I had to drive several hours to get to the post office, then to dial or to send a fax, okay? Now everybody has a mobile phone, and a huge percentage of people now have smartphones. And on that basis, we're going to see big changes in terms of digitization and leapfrogging in healthcare. And we're ready for that. That's what's going to bring disruption. And of course, the other thing is politics. Now, politics affects us. We can't ignore it. It affects us all. But there's medical politics too. I'll give you an example. I had a patient, sadly, who was involved in a bomb blast and was taken into the main hospital in Kampala, the Malago government hospital, had a neurosurgery carried out, did a good job. Unfortunately, the guy ended up in a vegetative state and he was taken back to the village. But he worked for me as a guard, and we had medical insurance. Now, this happened about 4 months ago. For 4 months, I've been calling Malago, asking, can you please give me a discharge letter so that I can claim from the medical insurance company, and I can give this guy a few million shillings. The deputy director of Malago told me, he said, I said, why couldn't you write the letter? I'm a medical doctor. I gave him the history in case he says, no, I can't write it. It has to be written by the neurosurgical unit. I said, okay, I know some of the consultants. Why can't Joel Kibias not write it? He said, no, he can't write it. It has to be written by the head, the guy who took. This guy has taken 4 months, and I still don't have that letter. Now, should we not be ashamed of this behavior? If we think our position, that our position is so important that we can delay someone for 4 or 5 months, somebody who's in a vegetative state who just needs a little bit of money, I think that's a shame and disgrace. And I think that there's too much that goes on, and we kowtow to position and to titles, and we don't take a common sense approach. And I hope this conference, we will be able to say, how do we solve our problems? We're not looking for medical tourism from London. We're looking for people within the region where we can get solutions. As I say, I have a small clinic in South Sudan. Many people in South Sudan, we've got a delegation from South Sudan here, will go out of South Sudan for some investigation where it actually can be done there in Juba. Or it could be done, or maybe they go to far away when they can come to Kampala or they can come to Nairobi. And we need to help each other. To me, there's a sort of a pecking order. I'm saying, I believe Kenya's ahead. But those of us, whether it's Tanzania, South Sudan, Uganda, and so on, we need to help each other and build up the region, take down the barriers, get rid of the politics, talk sensibly, and see how we can build up the medical sector, the healthcare sector. Thank you very much.
So much for the wonderful insights. So moving right along, we'll head to a bit of policy. So I'll welcome Dr. Samora Otieno from the Foreign Commonwealth and Development Office, the Kenya Health Team leader, to give a few remarks.
Guest of honor, ladies and gentlemen, good morning. My name is Samora Otieno. I'm from the British High Commission, as has been said. So just want to start by thanking the organizers of this great event. Great to see that this is the first time that this is happening. And just to mention that from where I sit, the time is perfect, I think. The cast is impressive, the regional cast that we have here. But most importantly, as has already been alluded, the content of the conversation is very appropriate as well. This comes at a time when, as has already been mentioned again, we're reeling sort of from the effects of the pandemic, which we've learned a lot of lessons from. As again been pointed, from my point of view, I think the key things that came out of that are capacity issues in terms of just how much capacity we didn't have to respond to this. But there are also issues of quality in terms of just the quality of care, as again has been talked about. And again, this is generally speaking. I know, if you think about it from the region, different countries were in different places. Some countries were probably better placed than others. And even when you talk about quality, there were definitely some facilities that had better quality than others. But I think also the key thing that came out of that was just how in one hand, we are very connected to the rest of the world, and at the same time, very disconnected to the rest of the world. And why do I say this? Connected because, what began initially as a problem in one part of the world very quickly became a problem for all of us. But then disconnected, again, as has been pointed out, because when it now came to the response, we really found ourselves very much on our own. And what we thought was available collectively, there was a time, I think, when, globally speaking, there was an oversupply of vaccines, but for some reason, we just couldn't access it. So that, for me, talks to the disconnect that we had. And I say this is coming at a time because I think we need to have this reflection and see what is it that we can do for ourselves. How can we make sure that we are more self-sufficient? How can we ensure that our people have access to that same level of quality that for a long time we've been going out for, and now we need to access here? If you think about it as a region, we have a big market. And so this is looking at it from a business perspective. With the inclusion of DRC into the East African community, we are now talking a population of 250 million people. That's a significant market from an investment perspective. It's been said here about the quality of our human resource. So that's really not exactly the challenge. We have very qualified people. We have challenges in the system, but the people are very strong. They go outside there and they really excel. The challenge has always been mostly about investment areas of infrastructure, technology, and as a policy system that we've talked about. 21 years ago, our country is committed to the Abuja Declaration, which was around domestic allocation of resources. To most of our countries, this still remains a big challenge. For a long time, we've depended on donor resources, but these are also drying up. And I see an opportunity here for conversations like this because we now need to start thinking about how do we go outside that traditional, either domestic or donor funded, and how do we start engaging with the private sector in a more meaningful way. So I don't want to take too long in this conversation, but I think a few things that come to me as we think about, as we deliberate on this for the next few days. What is it that the government can do? What is it that the private sector can do, or what role can the private sector play in this? And then finally, what is it that us as development partners can do? Again, as been said here, I think for the government, there's a question about the policy and sort of just the regulatory framework and just making a conducive environment for these kind of conversations to happen, but most importantly for us to have some meaningful change in terms of attracting investments into healthcare space. But there's also something about movement. We talk about 250 million people, but a lot of them were really pigeonholed into different countries. So movement is very difficult. So an investor who comes in needs to see that actually this is a pool of 250 that you can very easily access. I think there's a big challenge that needs to be dealt with as far as just regional integration is concerned. For the private sector, I think there's a lot of initiatives like this. So congratulations to teams like Strathmore that have been leading on this. I think Open Fences have been doing some work about this, about trying to create that space where the private sector can interact with the public sector, through this ecosystem approach where we're looking at health in totality and seeing what the different sectors come and play. Because we are so interlinked that a problem in the private sector, especially in the healthcare, very quickly affects the public sector as well. And then for the development partners, I think it's just for us to start thinking again, how do we engage across the board, again, taking that ecosystem approach, because traditionally we've looked at, we'll just support the the public sector. And in most cases, we've tended to see the private sector as enemies. We're supposed to be making things available. You guys are only coming at it because you want the profit, and so we don't see an opportunity for us to engage with you. So I think that needs to change. We need to break those barriers and just see how we can do things differently. Thank you so much. I don't want to take too much time. I wish that the participants in this few days are going to have very useful deliberations, but most importantly, that at the end, we're going to come up with clear action points that in subsequent conversations we'll be able to build on. And so this will not just be another conversation that we have, and then the recommendations are packed somewhere. Thank you so much, and have a good day.
Thank you so much. A round of applause. So next up, we have Julius Karima, the Director of Industries, Ministry of Industrialization, Trade, Enterprise Development, Kenya, to give a few remarks.
All protocols observed. Distinguished guests, ladies and gentlemen, good morning. I'm here in place of the Cabinet Secretary who should have joined you, Honorable Betty Maina. So allow me to make the remarks that she would have done if she was here. I'm delighted to join you during this Expo, and I take this as an opportunity to thank the organizers for this event. The outbreak of COVID-19 and the ensuing demand for vaccines and medication to save the lives greatly exposed developing one's vulnerability from being over-dependent on imports for their essential supplies. The collapse of the global supply chains owing to the lockdown and travel restrictions virtually curtailed many operations and rendered life difficult, leaving many developing countries like Kenya to rethink the need for strengthening their strategic industries. As the pandemic explained, populations in developing countries panicked as vaccines were being withheld from the developing world and the developed world, which prioritized to serve themselves first. In the circumstances, the ingenuity of Kenyans was called into play, and as a country we came together, stakeholders in the health sector and the industry, to chart the way forward in addressing the danger the country faced. This culminated in Kenya Bureau of Standards issuing for free standards on face masks and sanitizers, and enabled many firms, including SMEs, to participate in the production of personal protective equipment. Within a short time, the PPEs were available for all Kenyans and at affordable cost. Our Kenya Industrial Property Institute, KIPI, also reached out to innovators to come forward and protect the intellectual property for free. We have witnessed that as a country, we have immense potential to make things happen when we plan and execute our strategies together. We now need to build on the lessons learned and move forward our health sector, drawing from a common national health care agenda. Our quest for universal health care calls for strengthening domestic manufacture of essential medicines and medical devices in order to ensure their uninterrupted supply, and even for the purposes of bringing down costs. This in turn should go hand in hand with the support for local industry through preferential procurement. We must develop a taste and preference for locally made goods and services. Ladies and gentlemen, as you may be aware, the East African Community, partner states, considers having a vibrant health sector as strategic to its well-being, and aspires to develop its pharmaceutical industry to the level of being able to address most of the region's disease conditions. It is for this reason that the 36th Council of Ministers meeting on 20th February 2018 in Kampala, Uganda, approved the second EAC Regional Pharmaceutical Manufacturing Plan of Action covering 2017 to 2027. The meeting directed the Secretariat to work in collaboration with the partner states to develop a harmonized regional list of essential medicines and medical devices that can be manufactured and procured from the region. It also gave emphasis on partner states to accord the list a higher common external tariff amongst other preferential measures. Partner states were also urged to identify some essential molecules which the region consumes and for which the region has capacity to produce, and accord the same preferential public procurement. Kenya has done very well in supporting local industry, with the public sector being the champion for locally made goods and services. Towards this end, and working together with the stakeholders, we prepare and update and publish preferential procurement master laws as guide to procuring entities on the products which are locally made, and in order for them to be accorded preferential procurement. The recently published Preferential Procurement Master Law Number 1 of 2022 contains 496 product categories, out of which 255 comprise medicines, medical supplies, medical equipment, and medical laboratory supplies. Ladies and gentlemen, in conclusion, Our economic growth is progressively getting us wind from support by Global Alliance for Vaccines and Immunization, and we will need to provide for taking up full course of the country's vaccination requirements. Hence, the need for a domestic manufacture of human vaccines, among others. From the ministry, we invite you, the stakeholders, to collaborate with us and create a conducive environment for such an industry to site its operations in Kenya, to cater for the Kenyan needs, East African, and the rest of Africa. With these remarks, once again, I want to thank you and wish you fruitful deliberations. Thank you.
Thank you so much, Julius. So at this point, I'll welcome Brendan Quinsiga, Technical Health Financing Officer from the World Health Organization, to give his remarks.
Thanks very much, distinguished guests, ladies and gentlemen. I'm delivering these remarks on behalf of Dr. Diallo Abdulrahman, who is the WHO representative to Kenya, who is unable to join. I think most of the UN family is missing because we have some coinciding activities. So I think for the starting point, we have had so many speakers with so many good messages. So I'll try and abide by timekeeping by skipping some of the key messages or emphasize where I need to. But I think the starting point is if you reflect on the theme of having East Africa as a hub for specialized medical care, investments in health, and innovative solutions, you'll notice that our usual discussion around ecosystem approach in health goes beyond just the medical sector. So I'm happy that I'm speaking just after the colleague from the Ministry of Industry, because even the discussion Da Silva gave us in the morning around electricity, around the 3Ds, some of those are not within the control of the doctors who are here. I know we want to make this discussion beyond the doctors. So emphasizing that the ecosystem approach is not just a discussion that doctors should have, that ministries of health should have, but something that we are going to have with ministries of trade, ministries of industry, for us to be able to achieve this theme around specialized medical care, investments in health, and innovative solutions. Now, of course, again, colleagues have talked about the effect of COVID, and with many noting that it didn't affect us as much. But you notice that COVID affected economies, and economies and health systems are very interlinked. So we may not have lost as many lives, but the effect on the economy is of course affecting some of our health systems, both in terms of financing, but also in terms of ability for the people to live healthy lives. So if we are going to work together collectively and strategizing how to position East Africa as a center of excellence, we need to see how we can stimulate activity within our economies to stimulate the health systems to perform as we would want them to do. Now, we have had, of course, from Ian Clark, from other colleagues around, the different issues happening within the East African countries. So, yes, there are problems, but we know that the countries also have different comparative advantages. There are some things which are unique to the systems that probably could place them at a place of competitiveness. And having been lucky to interact with most of the sector strategies across the at least 3 countries or 4 countries, I know, for instance, in the Uganda one, strategic objective number 5 is around making the health sector competitive. In Kenya, I think it is number 4. So at sector level, we are strategizing for competitiveness, but I think we have been speaking to ourselves. So I believe this convening by KHF, Strathmore University, and other key partners should allow us to be able to co-create and share solutions that go beyond the discussions we have within the confines of the health sector. So it's an emphasis that, again, I'm very lucky that we started with Da Silva, who took us a bit away from the health sector, but also spoke very key things that were relevant to the health sector. So let's use this opportunity as a a convening of East Africa, a convening that is beyond the health sector, to be able to think about the solutions that can make us that hub of excellence that we want to be. Because if you heard from Nick, within the medical fraternity, even when you have the skills, at times it's the simple personality issues. And the same example given by Dr. Clark around writing a letter. At times we forget that we are human beings and we operate as machines, yet we are within an ecosystem. So the people of tourism, when they are talking about making us a good tourist destination, they teach people how to receive visitors, how to handle them, what to sell to them. So if we are talking about medical tourism, we also need to start thinking about the specific skills we need to impart in our health workforce that makes them part of our medical tourism package. So I think that's also an important emphasis. And of course, using the opportunity of being in a university auditorium, we are already now imparting some of the things that the trainers need to start imparting the students. So it's a role beyond Dr. Kibias, who is within the ministry, but all the different collaborators within the ecosystem. Now, just to emphasize, as WHO, of course, there has been growing recognition and emphasis of the need to work closer with the private sector, and I think in 2021, a strategy on how to effectively engage the private sector was developed, which emphasizes some key principles around strengthening dialogue, policy, regulation, partnership, and financing. And all those 5 have been mentioned by the key speakers here. And I believe these principles are central to the efforts of making East Africa as a hub for excellence. And having looked through the themes of the different discussions that we're going to have at this meeting, I believe we'll be able to talk to some of those aspects and have workable solutions that we can recommend to our governments, but also can be able to take as the private sector actors. So it is my expectation and the expectation of WHO that for us to be able to achieve the enabling access to specialized medical care, scaling up innovative solutions and attracting investments, we'll be able to learn from other countries. I'm sure, as I said earlier, we have competitive advantages. We're able to showcase very different things. And we're able even to learn from our shortfalls. So having shared as a room, as an East African region, we should be able to see some of the solutions that we can adapt as countries, and we can work with the government and with the development partners on how to put in place enabling policy frameworks and dialogues that can be able to help us solve this solution. I think also talking within Kenya, Kenya, first of all, as you heard from the previous speakers, has made immense progress in terms of supporting delivery of care, but also from the private-public collaboration, they are trying to champion an ecosystem approach that enables complementarity between the public and the private sector. I'm sure this discussion should be able to catalyze, to stimulate them to share what they have learned and to be able to make them a leader in the region for others to learn from what Kenya has done. So as my call to action, I need to emphasize that making East Africa a hub of excellence needs collective action from all the sectors, from everyone in the room. So let's spread the discussion beyond the daktari. In the health sector, everyone is daktari, and bring on board everyone so that we can able to think and strategize better. So with those few remarks, I hope there were few. I would like to thank you for inviting us, and we appreciate the organizers for this good event. I know the room is going to get filled with time, but we need to appreciate those who put this together. Thank you very much.
So thank you so much for those wonderful insights. We sincerely apologize for the time delay. So at this point, I'd like to introduce to you our United Nations resident coordinator for Kenya. He did a video for us. So it's a short video that we'll do. Then we continue with the remarks as well.
this Expo is a fabulous opportunity on two fronts. First, for a partnership to emerge, you need relationships. And so this Expo is a real opportunity for show and tell, to showcase what's working and to tell about the opportunities to come. That's a generic thing. That would be true of any Expo, but specifically with regard to the health sector now. First of all, it might the challenge of delivering primary healthcare services to the poorest of the poor in the remotest corner of Kenya, and the notion of high-tech medical tourism as a growth opportunity for the Kenyan economy might seem as though those two things live in different worlds. They don't. They live in the same world. The health sector is one sector. And I think the Expo is a really good opportunity for us to showcase how there is good to be done and money to be made along the totality of that spectrum. And that's a really important thing. So there is opportunity, as we already highlighted, in the primary healthcare space. But there's also massive opportunity in terms of medical tourism. Kenya has long been a continental center of excellence in healthcare, and that's becoming more and more the case every year. And I can see this as being a major plank in Kenya's economic growth strategy for the future, growing medical tourism within what is already an incredibly successful and burgeoning service sector that Kenya offers to the continent and to the world.
So thank you for that piece of advice. Apologies, he couldn't be here with us today. So we move right along to the regional aspects. So I'd like to invite Dr. Francis Mwanisi, the Registrar of Private Hospitals Tanzania, to give a few remarks.
Good morning. I think most of the issues have been explained, and some are going to be discussed during panel discussions. I would like to convey my greetings from Tanzania. Tanzania believes in a strong East African community. What we are experiencing here today is a belief by all East African member states that we can move together. We can move together as a powerful bloc if we commit our effort and focus on one strong community. Tanzania has a strategy to ensuring that it becomes a medical tourism destination, but it cannot do it alone without working together with other East African partners. It is high time, I think we should start, when the adventure, we should perform it cascadically. It should start with intra-East African medical tourism, where there is without barriers. I think the first thing that I was asking myself, on the 19th August 2019, we had East African members agreed to establish regional center of excellence, whereby Kenya was supposed to open a center of excellence for kidney diseases, Uganda for cancer, Tanzania for cardiovascular disease. Rwanda was given the task of opening center of excellence for e-health, rehabilitation, and vaccinations. We should ask ourselves, what matter did arise during that meeting? What are the resolutions that we have achieved? What are the challenges? And how far have we reached? What innovation are we going to address those challenges? In so doing, actually, we are going to have a continuity of solving our own tasks. Then from intra-East African medical tourism, we can move for intra-continental medical tourism. and finally, intercontinental medical tourism. In so doing, we shall keep East Africans in East Africa, and bring foreigners to East Africa. And finally, I think we should also ask, how are we using those data? For instance, in Tanzania, we tried to review the data, I think, for 10 years back, and we realized most of the cases that make our people go to seek treatment abroad were cancer, cardiovascular disease, cochlear implants, rep scan, and stem cell transplants. We have tried to address some of the areas. How far have we reached? Ladies and gentlemen, it is high time we make a decision that what we want to achieve, and we are quite sure in so doing we shall reach our destination and the cry that we have been crying for a long time. I wish you all the best in the Expo 2022, and I welcome you to Tanzania in the next Expo edition. Thank you very much.
Thank you so much for the warm regards from Tanzania. So from Tanzania, we head to Juba. I'd like to welcome Dr. Kendeide Chop, the DG International Health and Coordination, South Sudan.
Good morning. I also bring greetings from South Sudan, and I would like to also appreciate the organizers and would like to say this is our second time, and personally my second time to participate in this kind of engagement, which is very, very important. I'm delighted to inform all the participants that South Sudan, as we always say it and many people hear it, is a young nation. We come to such forums to listen, to learn, to see how people have been moving along, and more importantly, within the EAC region, the Eastern Africa region. We are here, and I would like to let you know that we believe where South Sudan is today, South Sudan is going through an experience that many, if not all, the countries in East Africa have one day gone through. There is nothing really new, and that makes us to believe that you are available for us to learn from your various experiences. And this makes me to advise that there has to be a positive and a commitment to support South Sudan, in the sense that the current narrative about South Sudan is not new to all of us. Every single thing is something that we have all gone through it. And I can also tell you there are many things that we do today in South Sudan, whether bad or good, that we have learned from you people. Whether it is Uganda, whether it is Kenya, whether it is Tanzania, name them. So, coming here, talking about private sector, I would want to let you know that in South Sudan, there is a huge opportunity. I'm not saying I might be disappointed, but I would want to tell you, from last time when I attended the meeting and up to today, you still haven't seen any significant change in terms of partnership and investment from the region in South Sudan when it comes to the health sector.
I would want to take this opportunity to appreciate my brother here, Ian, for the investment and the support he is currently doing through the health facilities that he has brought to South Sudan. I want also to say that South Sudan has got a unique experience. Much of the health investment and much of the health services in South Sudan are being supported through the organizations, non-governmental organizations, and mostly international organizations. I want to let you know that is not the best option for us. I sit at the Ministry of Health. I'm in charge of partnership, whether with the NGOs or we call them development partners, and also the public-private partnership. I want to let you know that there is a clear commitment and there is a paradigm shift. We would want to see more partnership with the private sector. We believe there is much more gain and much more value in what the private sector will do. With the development partners and with the NGOs supporting the health services, I can tell you what I always tell our partners. I was happy that our WHO colleague was here and he spoke. In South Sudan, we have UN agencies that are also implementers, international organizations that are implementers. I can tell you clearly there is no value for money in that investment. And I can challenge anybody that can say there is value for money in that. And what they do is not and will never be sustainable. I see a huge possibility in partnering with the private sector that can achieve so many things, can achieve sustainability, can make the system resilient, and will also show value for money. Because the choice will always be there. Currently, it is a mindset. Doing business in health is very risky, is huge. The private sector is there for money, as many people said it earlier, but I could tell you that we have a huge population that are traveling outside South Sudan to seek medical services in countries where the health services are not provided by NGOs. I want to say a lot of investment comes from the funding mechanisms. My last advice as a region, as a son of the region, through our little experience that we have currently, it is sad to see that nothing much is being done by our own people and our own governments, especially when it comes to investment in the health sector. I was not very excited when I saw the first, one of the first sessions we had was about Global Fund replenishment. I want to tell you, in South Sudan, I have been a CCM chair, Country Coordinating Mechanism chair for more than 5 years. I have attended a big number of Global Fund engagement meetings. I like what Global Fund is doing, but I also want to let us know, please and please, there will be much more value in what we can do ourselves. These mechanisms will come and they will disappear one day. Currently, Global Fund supports the 3 diseases, COVID-19, the health systems. Over 75% of the Global Fund money comes to Africa. But in this process, we have learned that we are adopting a character and a value that has never been in us on this continent. We tend now to like what we are doing. In South Sudan, I keep telling my fellow colleagues and our leaders, we need to minimize depending on the external funding. I say this simply because Global Fund messages are good, we are getting money. But if we also look from a different perspective, I come to a conclusion that human beings, at sometimes, we need to admit that we are born hypocrite. I used to challenge my own leadership, my own colleagues, our population, that whoever that moves on the streets, begging, whether carrying a bag or a small container in front of the restaurants, in front of the supermarkets, we look down at them and we call them beggars. When you get someone that, like any of us here, with a necktie and a coat and a suit, seated in an office with an AC and a funny title called Program Manager, Director General, we feel fine, we are proud, all as if we are doing something good. Brothers and sisters, what is in this is just begging. It's just a mere begging. Simply because what we go through, I have been doing this for over years, for more than 15 years. There are a lot of conditions. There is a kind of humiliation you go through, which touches on your dignity. Touches on your dignity. So what we do, we are only using different tools. Those move with the containers, with the bags. We are using computers, we are using desktops, the internet, and we feel proud. We travel from here to Geneva, to New York, to all this, saying that we are negotiating grants and doing all this, getting money. It's fine. For time being, let's do that for the sake of our people. But it's time for us to look at what we can do differently. What we can do differently is to invest together, partner with the private sector, do something that we are proud that we can call ours. I want to conclude by saying, despite the fact that all the countries currently are depending, or at least are supporting their health system and health services with the donor funding, I would also want to tell you that I'm convinced there is no any donor that has more money than a government. We always have more money than the donors. It's a matter of us showing more commitment. At least subscribe to the Abuja Declaration, and let us see how many have actually subscribed to that. Global Fund Replenishment, last time was done in Lyon. Over 75 countries pledge. Unfortunately, a month ago we had a meeting. Only 17 countries in Africa managed to fulfill their pledges. And what has been paid so far is less than 17 million. This is a big shame. But nevertheless, let's commit and look at ourselves and think what we can do differently. Thank you.
So thank you so much for the wonderful insights. So at this particular point, I'd like to welcome a public health specialist who supports health interventions, promoting community participation, pro-public health, and improving population well-being through improving well-being of others. He cares for environment through tree planting and environmental conservation. His main objective is therefore to assist government and organizations achieve public health, regional, and international targets. A round of applause to our keynote presentation, Dr. Simon Kibias, the head of the Directorate of Health Standards, Quality Assurance, and Regulations. Karibu.
Thank you so much, Nelson, for the welcome remarks. Good morning, everyone. Yes, I'm privileged to stand here before you this morning and represent Director General for Health, Ministry of Health, Kenya. As you've been told, my name is Dr. Simon Kibias. I'm the Acting Head Directorate of Health Standards, Quality Assurance, and Regulations. So this is one of the directorates that supports the Director General for Health. Thank you, colleague from Sajong from Southern Sudan, for the wonderful remarks you've made. Really, here in Kenya, before I read the message from the Director General for Health, I feel very honored to be present here in this expo. It's true, as per the theme, it is possible for East Africa to be a hub of specialized care for innovation and maybe stop the referral abroad. I think here, basically in Kenya, my experience is that the legislators have inspired us at the Ministry of Health to come up with a mechanism to try and reduce the outward referral. So in Kenya, we have guidelines developed by a regulator, a leading regulator, Kenya Medical Practitioner Identity Council, to guide the process of referral abroad. So we have a committee in which I chair, composed of various specialists. So what I can say is that in the recent past, I've seen a decline in, for example, pick on one case, a type of intervention that was commonly referred to India and other places of the world, the kidney transplant. That one, in the recent past, we've not signed letters of referral abroad. I think one of private sector investment entity here will be making a presentation on how they have improved on kidney transplant here in Kenya. And our experience during the COVID pandemic was such that the referral abroad cases reduced to almost zero. I don't know where the patients that have now come up for referral were going at that time, but this is a big lesson to learn that I really would like to appreciate the speakers before me because they have emphasized the need for resilience building. That means investing more in our health system so that when we go through situations like the pandemics, like we've experienced now, we have a place to go in case we needed an intervention that is needs a specialized care. And this reminds me, I hope you're still taking precautions because the pandemic is still with us. Yeah, it's not yet over. Of course, we in Kenya we have done very well. Yeah, working together with all multi-sector approach, and we've been able to register a lot of success. Well, so much for that. I would like now not to spend much of your time. I think it's my privilege, my an honor to deliver to you the message from the Director General for Health, Dr. Patrick Hammoth, who is also the executive chair, is a chair of the executive board of the WHO. The apologies from the top management, most of them are away in the World Health Assembly in Geneva. So, Mr. Julius Karima, Director of Ministry of Industrialization, Dr. Kibias Chong, Director General of International Health Coordination, Southern Sudan, Dr. Francis Mwanisi, Registrar of Private Hospital, Tanzania, Brenda Kwasige, the Technical Health Financing Officer, World Health Organization, Dr. Samora Otieno, Foreign Commonwealth Development Office, Kenya Health Team Leader, and Dr. Ian Clark, Chair of East African Health Federation, Charles Kutumo, the CEO of East African Chamber of Commerce and Agriculture, Nicolas Nesbit, Chairman, East Africa Business Council, Flora Mutai, the Chairperson, Kenya Private Sector Alliance, Dr. Kakombe, Kenya Health Federation Chair, Professor Hesael Del Silva, DVC Research, Strathmore University, development partners, the government officials from different ministries and departments, agencies, ladies and gentlemen, good morning. It is with great pleasure that I hereby officiate this very important East Africa Health Expo 2022 today. I have been made aware that this expo will be used to showcase East Africa as a hub for specialized medical care, investment in health, and innovative solutions in the health sector. It is estimated that Africans spend about shillings 380 billion annually in search of health care overseas, predominantly in India, Thailand, and the Middle East. In 2016, 10,000 Kenyans sought medical treatment outside the country, spending between shillings 7 to 10 billion annually. And this is the trend in the entire East African region, with over 100,000 people leaving the region to receive healthcare abroad. Most patients usually travel for elective surgeries of joint replacement, cardiac-related issues, cancer management, neurosurgery, in vitro fertilization, organ transplant, cosmetic, and dentistry. This happens even though East Africa is in a commendable position to deliver good clinical outcome in these areas. While it is evident that the outbound medical tourism is economic drainpipe, East Africa has potential to be a premier medical tourism destination in Africa, with the different centers of excellence being developed in East Africa country. In the increase in focus funding and the health policy shifts towards universal healthcare, the excellent specialized care hospitals, and increased foreign and local investments in the health sector. Indeed, East Africa is an untapped center for medical tourism. Ladies and gentlemen, how then can East Africa enhance its ability to become a destination for health tourism? Firstly, there is need to look for partnership with overseas hospitals that are adept at treating diseases. Encourage them to invest in East Africa by setting up local branches that employ qualified healthcare personnel. This way, they treat East Africans in East Africa and therefore contribute to the economy. Such partnership will also lead to exchange of knowledge and skills and improve the quality of healthcare offered in our local region. Secondly, I would like to challenge East African hospitals and clinics to find ways of marketing available medical services to potential clients within and outside the region. There should be a sound investment in marketing of medical services in the region to enlighten patients to know that they don't have to travel abroad for services that can be accessed at home. And for this, I applaud the team behind the East African Health Expo, because for the first time, a health trade fair has been convened to showcase East Africa as a center for specialized care, innovations in health, and interventions, investments in healthcare. Thirdly, let us strive to reduce the fragmentation in the healthcare sector. Often, the public, private, faith-based sectors of health act in silos, each with their own pricing system, referral guidelines, data management systems, and even training. I challenge the health leaders present here today to strive to abolish this fragmentation, not only in their own country, but in the East African region entirely. In concluding, I would like to appreciate the efforts of all the organizers of the East African Health Expo 2022, namely the Kenya Health Care Federation, KHF, Strathmore University Business Schools, and the UN SDG Partnership Platform, UN SDG PPP, Private Partnership, who have undertaken the initiative to advance the health agenda of East Africa and bringing the health sector closer to the Vision 2030 and the achievements of universal healthcare coverage. From the government of Kenya, asante sana, and we look forward to more collaborations and partnerships. With those few remarks, I hereby declare this East Africa Health Expo open. Thank you, and be blessed. Thank you.
Thank you so much, our keynote presentation, for the remarks. So I'd request you to stay upstanding on the stage. There's a small token of appreciation. Kindly allow for a photo session, a minute for a photo session, Dr. So thank you so much. A better round of applause, ladies and gentlemen. So at this point, we're going to the sessions for today, and the theme is medical tourism, East Africa as a hub for specialized care. So we'll start off with a session with one of our partners, that's Gertrude Children's Hospital. I'll call upon the CEO, Dr. Robert Nyarango, to give us a few remarks to open up